The tip I'm going to give at the end of this video could save your life. I'm going to tell you 8 dangerous signs and symptoms of diabetes when you really need to worry and seek emergency medical care. How can you recognize this condition, which has a high mortality rate? I'm talking about diabetic ketoacidosis. Let's talk about this and what you should do. Lab values, what you'll feel when this acute complication can happen. Why is this so important? Why do we need to talk about this? Because it's a complication that can develop in just days or even hours, unlike other complications like heart problems, for example. But why is that exactly? When you are living with diabetes, it can often take many years, or sometimes even several decades, before you actually suffer a heart attack because of the condition. This means that you actually have plenty of time to plan ahead and to implement healthy lifestyle changes that will truly help you to prevent that heart attack from ever happening. It's the same thing with a stroke, or even kidney disease caused by diabetes, diabetic nephropathy. You have time to take action. These are called chronic complications of diabetes, but that's not the case here. The time frame is very short, sometimes just hours, as you've seen. So it's important to recognize the signs and symptoms so you can seek medical help as soon as possible, and also know how to respond, because this complication called diabetic ketoacidosis can happen. Why are these dangerous signs and even deadly signs? I'm not exaggerating when I say that, okay? Because if it's not treated, 100% of cases, look, 100% of cases. When have you ever heard me talk about 100% of cases? Almost never, because that's really rare in medicine. There's even a saying, in medicine and in love, there's no such thing as never or always. But in this case, yes, it's always 100% of untreated or unrecognized cases of diabetic ketoacidosis will end in death. And you'll understand why. So let's talk about the signs and symptoms. And then how it happens, the diagnostic criteria, and the tip that can save your life. It's honestly a really useful tip. When I started my channel, my very first video, the one that motivated me to get on the internet, was because I had access to diabetes mortality statistics. And that statistic really caught my attention. We're talking tens of thousands of deaths from this complication, diabetic ketoacidosis. And it's a preventable complication. If you know about this, you can actually prevent it, even prevent death. And it's a statistic that really hurts, because there are diseases that have no cure. Sometimes there's really nothing you can do. You know that. There are illnesses that just happen and we can't do much about them. But this one, yes, it's a preventable disease, a preventable cause of death. Look, that's why this video is so important. So pay close attention to the signs and symptoms. There are 8 of them. What are these signs? Sign number 1, you start to feel really thirsty. Why? When your blood sugar levels start to rise, and in diabetic ketoacidosis, this increase happens more quickly, you'll feel thirstier. Why? To try to compensate for this rise in blood sugar, your body will make you drink more water. It's a way for your body to try to compensate for this sudden spike in blood sugar levels. So a lot of thirst. You find yourself waking up in the middle of the night just to drink some water, and then you start waking up again because you have to pee. Before, yeah, he used to drink about 5 or 6 glasses a day. Now you're drinking 15 or 20 glasses. It's a very noticeable, very pronounced change, this increase in thirst. And often, because it's easy to fix, people don't notice it. Oh, I'm drinking a little more liquid, but it must be because of the heat, or maybe it's something new I've started doing. And then this keeps going and keeps progressing. And why does this happen so quickly? Does it trigger diabetic acidosis? It's an acute complication of type 1 diabetes. Type 1 diabetes is an autoimmune disease. The body itself produces antibodies that attack the cells that produce insulin, the beta cells in the pancreas. So you have a reduction in insulin production, your body stops making insulin, and that's why your blood sugar levels go up so much. That's different from type 2 diabetes, which is insulin resistance. Your body has insulin, you produce insulin, but that insulin just can't do its job. This process of insulin resistance happens over months and years. This is the process of the autoimmune disease, which can lead to diabetic ketoacidosis in just days to weeks. So even if you have good test results from the last 3 months, for example, if you have these signs and symptoms, you really do need to seek medical help. Because many times the patient comes in with normal test results from 2 or 3 months ago, and they started showing signs of type 1 diabetes. So within just 15 days, you could be fine and then develop this serious complication. That's why it's important to pay attention. The second sign is increased urination. Why does urination increase? You might be thinking, oh, if I drink more fluids, I have to pee more. But it's not just because of that. Because the kidneys notice this increase in blood sugar levels and they start trying to get rid of the sugar. The kidneys are able to eliminate glucose molecules. And this change, where the body starts getting rid of more sugar through urine, begins to happen at not so high levels, at values above 180 milligrams per deciliter. If you're watching from a country that uses millimoles per liter, the value above 10 millimoles per liter is fine. So yes, that's the threshold. There are sensors that can also try to compensate for this by eliminating more fluids. There are other signs from the kidneys too, like an increase in infections, because there's more glucose available for bacteria. If fungi start to grow, there are also urinary tract infections and even ants in the bathroom. You might say, that's true, okay, because sweet urine with sugar, can attract ants. That's not hard to happen, and it's not always in the toilet, but also in the trash can. Sometimes you might wipe with toilet paper and sugar stays on the paper and there are a lot of ants, so that's a warning sign, okay? These are the issues here that involve urine. Even the name diabetes mellitus comes from that. Diabetes comes from the Greek word for siphon, because the patient urinates a lot, and mellitus means sweet. So a lot of urine, sweet urine, that's the meaning of diabetes mellitus. That alone deserves your like. You're already learning something new. Look at that. How interesting, right? A lot of patients like to know this kind of information. If you do, go ahead and hit the like button and subscribe to the channel if you haven't already. Let's keep going with the signs and symptoms. And sign number 3 is breath. There's something called ketone breath. There are a lot of stories about this breath issue because it's really noticeable to those who know about it. It's even possible to suspect diabetic ketoacidosis just from this characteristic breath, which is called ketone breath. But why does this happen? When you no longer have insulin to take the sugar from your blood and put it into your cells, into your muscles, you end up without energy, right? But the body tries to work around this by breaking down and providing energy through the production of ketones, the ketone bodies. Here's a really simple way to explain it. You can't use sugar anymore, so your body starts activating another energy pathway, and you also get rid of these ketone bodies through your breath. There are other places, but one of the main ways your body helps compensate for this, because at high levels they're toxic, is that your lungs start to eliminate them through your breath. And there's this sign, which is halitosis, or ketone breath, that bad smell on your breath. And sign number 4, which is pretty interesting, is weight loss. Losing weight. Why do they say that? Interesting, right? Because a lot of people think that a sign of diabetes is actually the opposite, that it's weight gain. When, in reality, when your blood sugar levels are really high and you don't have insulin working, you're gonna lose weight. Why is that? It's insulin that does that. It takes that sugar and puts it into your muscles, storing it as energy. If you don't have insulin working, then you're gonna lose weight. And this weight loss can't have an obvious cause. For example, you didn't start a diet, You didn't start exercising. You didn't have any changes in your routine. You simply don't know why you're losing weight. There's actually a number. If your weight loss over 6 months is greater than or equal to 10% of your body weight, that's a pretty significant amount. And that number already calls for a medical investigation to figure out what's going on. You need to check blood sugar levels, but also look at other conditions, like the thyroid. But in diabetic ketoacidosis, the patient loses weight, has this weight loss, because of what I just explained. And sign number 5, nausea and vomiting. I'm also going to include abdominal pain here. That's also common. Why nausea and vomiting? Because your body starts producing substances, making your blood more acidic. You lose your appetite, have less energy, and you feel more nauseous and vomit more. When I used to work in the ER, I remember very well that patients with diabetic ketoacidosis often reported abdominal pain too. Nausea, vomiting. So that's a sign you really need to pay attention to. But does that mean everyone who has nausea or vomiting needs to rush to the hospital? Now, here you have to look for other signs and symptoms together. If you're vomiting, drinking a lot of water, peeing a lot, and losing weight, these are pieces of the puzzle that will lead to the diagnosis. I'll talk more about the diagnosis, but it's important to highlight this. Sign number 6 is shortness of breath. In medical terms, we call this Kussmaul breathing. Why? As ketone bodies start to build up in our blood, in our body, the lungs try to get rid of them. And you might have this kind of breathing: rapid breathing, shortness of breath, and often an increased heart rate. Since this is a pretty distinctive sign, it might not be that practical for you. I know, it's more of a medical sign, but I'll highlight the shortness of breath, okay? And number 7, another one that really stands out is tiredness, fatigue. A decrease in physical fitness. It feels like you wake up already tired. Many patients report, "I'm waking up tired," and this gets worse pretty quickly. It's not that kind of tiredness that's been dragging on for 5 or 6 years, like a lot of people say. It's a different kind of fatigue. It's something that's come on in the last 2 weeks. Why is that? Your body can't make use of the sugar in your blood. To give you energy, insulin isn't working. You don't have insulin, you can't produce it, your body just can't make it. So what happens then? Your body can't take that sugar and put it into your muscles, into your cells, so you can have energy. So fatigue is one of the most noticeable signs. This is easy to identify, unlike shortness of breath. This one here, tiredness, is a sign that people notice. It's present in almost 100% of cases of ketoacidosis. And sign number 8 is mental confusion, difficulty thinking, which makes it harder for you to reason because the brain also locks energy. So what are the diagnostic criteria? I'm going to talk about the diagnostic criteria for diabetes, prediabetes, and then how to recognize them through tests and what's necessary. For the diagnosis of diabetic ketoacidosis, which is the complication I'm talking about here. All right, let's go to the first table then. I put together a table to make it easier for you to follow along with this video. And I can diagnose diabetes with 4 tests. The first test is fasting blood glucose, where a value for diabetes is greater than or equal to 126, and between 100 and 125 is considered prediabetes. Prediabetes, many people say prediabetes doesn't exist, but it does, okay? That's not a myth. And a normal value would be 99 or less. I also included the values in millimoles per liter. The numbers are here in the table, so if you're in a country that doesn't use this unit of measurement, you can still follow along. Another test, which is also very important, is glycated hemoglobin. What is that? It's the average blood sugar level over the last 90 days. So it's a test that, when properly indicated, is very valuable for diagnosing diabetes. Fasting blood glucose has some shortcomings. I could even make a video about that if you want, okay? But glycated hemoglobin, since it reflects the average, is very useful for diagnosing and monitoring treatment goals. For diabetes treatment, and a value of 5.6 or less is considered normal, 5.7 to 6.4 is prediabetes, and 6.5 or higher is the value for diabetes. It's also important to point out that there are two other tests. The random blood glucose test, what is that? It's a blood sugar test done at any time of day without a set schedule. For example, to make this diagnosis, the patient must have the signs and symptoms. For example, the signs and symptoms I mentioned, along with this blood sugar level. That's why there's this difference. The value has to be equal to or greater than 200, for example, which is called random blood glucose. This criterion also exists. It's a diagnostic criterion that's not often talked about, but it does exist. The other one, and this one is used a lot, is the oral glucose tolerance test. What is that? You do a fasting blood sugar test, wait 2 hours, and then you take 75 grams of glucose. And after 2 hours, you do another test to see how your blood sugar is, your blood glucose level. And here are the values, up to 140. That would be a normal value because your body just got a load of glucose, so it's normal for your blood sugar levels to go up a bit. So let me clarify something. This is important to point out here. From 140 to 199 is considered prediabetes, and 200 or above is the diabetes range. Always remember, there are other values here too, so you can follow along with the video. Now, that being said, how do you test for this very serious diabetes complication that needs to be recognized so it can be treated? And what can you do that might save your life? Well, we need to look for certain features in the tests. When someone shows up with these typical signs and symptoms, like bad breath, weight loss, the ones I mentioned earlier in the video, we need to check if their blood is acidic. Why? If there are ketone bodies, they make the blood more acidic. To put it very simply, so there are a few characteristics. The pH, which measures the acidity of the blood, needs to be decreased. At the value I showed here, if the pH is low, the bicarbonate should also be low. This will indicate something we call metabolic ketoacidosis, which is characteristic of diabetic ketoacidosis. All right, other characteristics. And this one is really striking, the presence of ketones. The most common test is a urine test. It will show there. Ketonuria, what does that mean? There are ketones in the urine, and that's a sign that this is happening, okay? There are some medications that can cause this. I'm not going to get into that here, but ketone bodies, ketones, what we call ketonuria, is a strong indication. If your blood is more acidic, you have these signs and symptoms, and your blood sugar levels are high. And there are ketones in your urine, we can already make the diagnosis. Diabetic ketoacidosis, medical attention is needed for treatment. All right, and now here's the tip I mentioned. It could save your life. If you suspect it, if you have these signs and symptoms, what should you do? Besides seeking emergency medical care, you've already seen that you shouldn't wait for a regular appointment. But if you suspect someone might have it, you should hydrate them, give them fluids, give them water. Because many people arrive at the emergency room extremely dehydrated. And this greatly increases the mortality rate because it reduces the time doctors have to run tests and start treatment. So stay hydrated, even before heading to the emergency room. It's important that you drink fluids, bring water with you if you can, and keep drinking while you wait. I don't know, but a lot of hospitals have long wait times, so it's important to keep hydrating yourself, because this will buy you more time and could save your life. A lot of people here, if you're diabetic and have already had this complication, leave a comment and you'll confirm that when you got to the ER, what did the doctor do? They immediately started you on IV fluids, exactly to buy time and start stabilizing you. Of course, it's not a definitive treatment, but it's a treatment that gives us more time to make the diagnosis and provide the precise treatment that could save your life. On a scale from 0 to 10, what score would you give this video? If it's a 10, I'll make more videos like this one. This video has to be a 10, okay? For the other videos, I'll accept an 8 or 9, but this video has to be a 10 because it's really important. Also, let me know which city you're watching from. I'm speaking from Porto Alegre. Comment here if you know someone who's had this complication, or maybe you already have it. Wait to hear. I'm gonna leave a suggestion. For you to watch, it's a video where I talked about the best foods for diabetics that don't raise blood sugar levels. Look how interesting that is. There are worse foods and there are better foods for people with diabetes. So you need to know about this too. If you click here, you'll be taken to that video. Take care. See you next time.